So chapter 13 goes over preventing infection. Now, we have asepsis is simply meaning being free of disease-producing microbes, okay? And that's in your key terms on the front of the chapter. But there is medical asepsis and then there is sterile asepsis. And when it's talking about medical asepsis, we're talking it's clean. Like you wash your hands, they're clean. Versus sterile asepsis, which means something has been sterilized so there is no living microorganism on that piece of equipment. Okay, so we'll go over that more here too, but kind of keep those in mind. So infection is a major safety and health hazard, of course, especially in long-term care facilities or assisted living because people are living in a community type of environment. And of course, older and disabled persons at risk because their immune systems aren't as good as they used to be. So the health team has to follow certain practices and procedures to prevent that spread of infection, and that is known as infection control. And infection control not only protects the residents, but it protects you, the staff, as well as visitors that come and go. Now you'll need to really look at your key terms and your abbreviations in the front of chapter 13 and know what they are so you can understand when I say these different abbreviations like MRSA or MDRO or something of that um, along those lines so you'll know what I'm talking about. I'll try to remember to say what they are, but sometimes I forget. So let's go on. Microorganisms. Microbe is a small living plant or animal, and it can only be seen through a microscope because it's so little bitty. So if they are everywhere, there is no place that doesn't have a microbe on it unless it's a sterilized piece of instrument because, and they can be harmful, you know, and they can cause infections. And that's an opportunistic microbe versus what we normally have on our skin because we actually do have microbes on our bodies at all times in all places, and they are not harmful to us, okay? So pathogens is is a microbe that's harmful and it causes infection. So it's an opportunistic microbe is what a pathogen is, and it wreaks havoc on a person versus the non-pathogen microbes, which are microbes that do not usually cause an infection. You'll hear that known as normal flora. So there's type of microbes. Bacteria are plant life that multiply rapidly. Fungi are plants that live on other plants or animals. Protozoa are one-cell animals that can infect the blood, brain, intestines, and other body areas. And rickettsiae, which are found in fleas, lice, ticks, and other insects. And then there's viruses, and they grow in living cells. So you've got 1, 2, 3, 4, 5 different types of microbes that can be found in our wonderful environment and that can cause us a lot of problems. So microbes have to have a reservoir, which is the host. This is where they live and grow. Okay. They also have to have water and nourishment from the reservoir, and most need oxygen to live. The warm, dark environment is needed, so that's why your surgeries are cool and very light, and most grow best at body temperature. Okay, so you know that's when you go to surgery. That's why they have it so cold, is because microbes don't grow well in cool temperatures. Microbes are destroyed by heat and light, and that is in the process of sterilization. That's what they use is heat and light to destroy any of the microbes on an instrument. The reservoir or the host. You're the host. Think of you are the host. You're the environment in which the microbe lives and grows. So people, plants, animals, soil, food, water are all common reservoirs. That's why in certain areas of the hospital, like intensive care, they won't let you bring in live plants because there are certain microbes that like to grow in the soil. And they don't want that person who's so severely compromised right there to be exposed to any more microbes than is already there in the environment. So normal flora are microbes that live and grow in a certain area. So like you have normal flora, microbes that grow on the skin. Multi-drug resistant organisms, or MDROs, are microbes that resist the effects of antibiotics. Now, I have to tell you, antibiotics are used to kill bacteria. Okay, antibiotics don't do any for viruses. There are antibiotics that can kill the fungi and the protozoa. So, I mean, there are certain, but they can't kill viruses. Antibiotics don't do anything for viruses. So, if you have a virus, we can't give you an antibiotic. Now, we do have some new medicines that are called antivirals, but they're not antibiotics. So there is a difference. So whenever you see an antibiotic, you know it can kill some things, but it cannot kill a virus. The MDROs are caused by doctors that prescribe the antibiotics when they're not needed, especially if it's for a virus, and not and then persons who take the antibiotics, they only take them till they're feeling better and not the full length of time that the antibiotic is prescribed. The two common types of MDROs are MRSA, which is methicillin-resistant Staphylococcus aureus. That's why it's easier to say MRSA. And then VRE, which is vancomycin-resistant Enterococcus. Well, when MRSA was first coming out and we were trying to prevent this from spreading, this is a really smart um, organism, microbe, that uh, can outwit the antibiotic we used to use for Staphylococcus aureus, okay? So it got really smart. And so we called it methicillin resistant because this was the antibiotic portion of the medicine that the germ, Staphylococcus aureus, became that could outwit the methicillin, so it would stay in the body and still wreak havoc on the person. So it was known as MRSA. Well, they invented a new antibiotic called vancomycin. It's a very expensive antibiotic that would I'm sorry, sorry, basically kill or destroy the MRSA. However, because people would not take the antibiotics for the length of time prescribed, this organism became smart. This Enterococcus became smart against the vancomycin. So we have a VRE. So when you have a person who has VRE or MRSA, they're really at risk because they can be really limited in what the doctor can give them for an infection. So an infection is a disease state resulting from the invasion and growth of microbes in the body. A local infection is in a body part, whereas a systemic infection involves the whole body. So local is one area. Systemic is just like systems, but a system is everything. So when it says systemic, that means it's everywhere. So an infection can become life-threatening before the older person has obvious signs and symptoms. And that's why it's harder sometimes to detect a person having an infection until they start showing signs and symptoms. So you may not get the signs and symptoms until late in the process. And older people don't always have a fever. They may not have any fever or just a slight fever, if at all, which is really hard. The first thing you usually see that indicates there's an infection are behavior issues. It truly is. Redness and swelling may be very slight in the older person, and they may not complain of pain, but confusion and delirium occur. Now, delirium is an acute confusion. Anybody can have delirium, but delirium is always caused by some underlying cause. So usually it's an infection. So, excuse me. So confusion, if you ever see that, confusion and delirium means it's an acute confusion that's caused by something else. So whenever we see those behavior issues, that's when they call the doctor and they get the urine specimen, and maybe they get some blood samples to make sure that they don't have an infection. So there's a chain of infection is a process. And at first it begins with a source. Now the source is known as the pathogen. And then it has to have a reservoir, the host, where it can grow and multiply. And to leave the reservoir, the pathogen needs a portal of exit. Okay. After leaving the reservoir, the pathogen then has to be transmitted to another host. And then the pathogen enters the body through a portal of entry, and then a susceptible host is needed for the microbe to grow and multiply. Now, when you are younger and healthier and you're in good health, you're not a very susceptible host, okay? The pathogen's someone who's weak. Okay, they're like the lion. They go out in search of the person that's weak, where they can grow and multiply. Okay, and then and here's an example. If a person has diarrhea, it's caused by a bacteria. Say I don't know, salmonella. So they can have vomiting, or they can have diarrhea, or they can have both. And so here they have this pathogen is growing wildly inside their body. They've been susceptible. It's growing. Now it needs a portal of exit. Well, it's got a portal of exit every time that person vomits or every time they have an episode of diarrhea. After they leave the reservoir, you don't wash your hands, but you have to clean the patient, or they get some of that vomitus or fecal material on your clothing and you're unaware of it, or on the floor and you step in it, or you don't know it because we can't see microbes, and you don't do good hand washing, then the next time you go to the next person and you touch them, no matter where, if you hold their hand, getting them up, whatever, and they put their hand to their mouth, they just transmitted that microbe to another person. Okay, and that's how things get spread. It truly is. Maybe that person was having diarrhea but didn't tell the nurse. They get up, they don't wash their hands, they go down the hallway and they hold on to the handrail. Every time they hold onto the handrail, they're leaving those little microbes behind. And then another pet resident comes along, they're self-propelling in their wheelchair and they're using that handrail to help them along. What's all over their hands? Well, those pathogens are. And then then they can have an access to the portal through a portal of entry. So it's very easy to spread these little things. It truly is. So the ability to resist infection relates to the age, their nutrition level, nutrition status, their stress level, fatigue, health, drugs, disease, and injury. And this could be anybody. Okay, so a healthcare associated infection is known as HAI, is an infection that is acquired in a healthcare agency. Okay, so it doesn't make if it's long-term care or if it's in the hospital. If you catch an infection while you're there, it's called an HAI, and the facilities do a lot to keep these down as much as possible, because usually there's going to be the insurances are not going to pay for an infection the person got within your facility um, that should have been avoidable. So these HAIs are caused by normal flora, and microbes are then transmitted to the person from another source. So we're talking look at it this way. A Foley catheter, they're the biggest HAIs there are the Foley catheters. A nurse puts in the Foley catheter. Something happens, maybe the tip touched something that was not um, cleaned properly or shouldn't have been touched at all, when but is, and then they insert it. Well, then the normal flora is now where it's not supposed to be, and it grows and multiplies and causes an infection. Okay, but there's ways that we can prevent this. Medical asepsis is one, and that includes hand hygiene. Um, Surgical asepsis, of course, remember that's the sterile technique that we nurses use in different types of procedures. Medical asepsis, everybody can do medical asepsis. Hand washing, housekeepers come through, wipe down the rails, and that's part of medical asepsis. Standard precautions. You don't use you wash your hands, then you put your gloves on, then you dispose of those gloves in the appropriate receptacle. There are transmission-based precautions, isolation precautions, and then the bloodborne pathogen standard. All right. See if it goes through. Okay. So in medical asepsis, again, this is we do this by clean technique. Okay. Surgical asepsis is sterile. Medical asepsis is clean. And we do medical asepsis when you wash your hands. That's basically what we're doing because we're either removing or destroying pathogens, or the number of pathogens are reduced. And that prevents the spread from one person to another or from one place to another. And sterilization is the process of destroying all microbes. And contamination, on the other hand, is the process of becoming unclean. So, preventing the spread of microbes, again, you got to wash your hands. You heard it said a million times, wash your hands, wash your hands, wash your hands. But you want to wash your hands after urinating or having a bowel movement, or when the patient has one too. And you need to have them wash their hands, even if they didn't help in any of the process. Have them still wash their hands. After changing tampons or sanitary pads, after contact with your own or another's person's blood, body fluid, secretions, or excretions. Coughing, sneezing, blowing your nose. Make sure you don't do that in your hand. Do it on your sleeve and your arm. And before and after handling, preparing, or eating food. Make sure that all persons have their own linens and their own personal care items. So you don't want to use someone else's soap on one of your residents if it doesn't belong to them. Cover your nose and mouth. Common sense. Bathe, wash your hair, brush your teeth, wash fruits, raw vegetables, or eating or serving them, and then washing, cooking, and eating utensils with soap and water after use. Again, hand hygiene is the easiest and the most important way to prevent the spread of infection. And you should practice hand hygiene before and after giving care. And that's always, sometimes it's a critical criteria. It should be a critical criteria no matter what. Supplies and equipment. Most healthcare equipment is disposable. Single-use items are discarded after one use, and a person uses multi-items many times, and non-disposable items are cleaned, then disinfected, and then sterilized. When we are doing the cleaning, this basically reduces the number of microbes present and removes organic matter. When we disinfect something, this is the process of destroying the pathogens. So we use what's called germicides, kill the germ. These are disinfectants that can be applied to skin, tissues, and non-living objects. Chemical disinfectants are used to clean surfaces and reusable items, your Lysol wipes or your Clorox wipes. Sterilization, though, destroys all non-pathogens and pathogens, including the spores. And that's a special process. Hand hygiene, cleaning, disinfection, and sterilization are all important aseptic measures. Isolation. When we get to isolation, that we put a person in isolation not to, um, you know, it's not to be punishment. It's to prevent the spread of communicable or contagious diseases. And we tell the person that up front. But isolation precautions are based on clean and dirty. You should have a clean area so the objects are free of pathogens, and then we have a dirty area for the that has become contaminated with the pathogens. And then the precautions just basically reduce the risk of spreading it. So standard precautions reduce the risk of spreading those pathogens and reduce the risk of spreading known or used in the care of all residents. That's why we wear gloves and the mask or the gowns when we do. Standard precautions prevent the spread of infection from blood, all body fluids, secretions, excretions, except sweat, and even if blood is not visible. Because, sometimes blood can be microscopic, we won't see it. Non-intact skin and mucous membranes. So understanding how infections are spread can help you be more conscious of what you can do to prevent that spread of infection, especially based precautions, and we'll go over that. Protective measures. Now we're getting into the protective equipment, personal protective equipment, PPE. Okay, and I've demonstrated to you how to put the PPE on, and then you have watched the film, the little video. But using special measures for removing linens, trash, and equipment from a room is a protective measure. Sometimes when a person is in transmission-based isolation, we put everything in a red bag because red means it's biohazard, it's contagious, okay? Or maybe it's got something on there that can be contagious. So sometimes we would have to do what they call double bagging. That meant I had to go into the room, I would remove the trash, bag it up, and then a person with the same type of bag would be standing outside the room. I would come to the door, we'd put that trash in it, tie it up again. It's called double bagging. But you would just basically, but to do that, you had to follow your facility's policy and procedure on which isolation or transmission-based precaution you're using. We do this when we also put things like when we collect specimens or we transport specimens, we put them in a bag that says biohazard, and we send them to the lab in that special bag so that anyone who comes in contact knows that it can be a potentially pathogen carrying product or substance. And then we use special measures to transport persons on isolation precautions. Sometimes that's why you see people wearing masks when they're being transported down the hall. It's because maybe they're on some form of transmission-based precaution or some form of isolation. They're a little interchangeable there. Transmission-based is going to be specific, whereas isolation is kind of a general term. So gowning and gloving, you got to wear gloves whenever you come in contact or whenever you think you may come in contact with blood or body fluids, secretions, excretions, mucous membranes, non-intact skin, where non-intact skin is likely. So if they have any type of cuts, anything like that, or some form of wound. Gowns and other attire protect your clothes and body from contact with these substances. The gown must completely cover you from neck to your knees. That's why they're so long. A wet gown is considered contaminated. So you would have to, if your gown becomes wet, then you have to remove yourself from the situation as soon as possible, take that off, put a new gown on. And disposable gowns are discarded after every use. Now, we kind of have the little cheapy ones for you to use. Now, when I go to facilities, a lot of them are going to the more plastic type of disposable gowns that you can put on for your isolation gowns. And so if they do get wet, it doesn't permeate the material basically. It's plastic, so it kind of runs off. Then we have mask and respiratory protection that prevents the spread of microbes. Masks are disposable. If the mask becomes wet or moist, it's considered contaminated. And that's why I tell you it's about every 30 minutes you're going to have to change that mask if you have to be in a room for that long. Practice your hand hygiene before putting on a mask. TB respirators or tuberculosis respirators are worn when caring for persons with tuberculosis. Remember, these are the special respirators that they have to have firmly on your face. It has to be fitted for you. Goggles and face shields protect your eyes and mouth, nose from splashes or spraying of these substances. And the outside of the goggles or a face shield is considered contaminated. Some places use face shields, some places use goggles. It really depends on the facility and sometimes just the unit that you're in. Personal protective equipment or PPE. Discard disposable eyewear after use. Reusable eyewear if it should be reusable. Sometimes you are given one to keep with all times that needs to be cleaned and disinfected before reuse. So if you do actually do use them, then you have to clean them and disinfect them after that use. Contaminated items are bagged to remove from the person's room, and we use leak-proof plastic bags that have the biohazard symbol. Sometimes I've seen them in yellow and sometimes in red. It just depends on the facility where they got them. Biohazardous, though, means these items are contaminated with a blood, body fluid, secretion, or excretion. Then we have to bag those items and transport those linens and trash equipment following the center policy. Double bagging is not needed, although we have done it in the past, unless the outside of the bag is soiled. And then specimens are transported to the laboratory in the biohazard specimen bags. And then there are procedures for transporting persons in the facility if they have some form of problem that could be contagious. Now, when you put someone in isolation, you really are limiting the contact they have with people. So family has to be informed. So that's why we put signs outside the door saying this person is in contact isolation or this person is in droplet precautions, whatever it happens to be, so that they know. And it's usually a sign that's big enough that they can read, as well as with visuals, so that they know they have to put on a gown, they might have to put on a glove, they might have to put on mask, whatever is needed before they actually go into the room. And then we often um, reinforce, make sure that they're actually doing it and that they wash their hands prior to and after they leave, basically to protect them and then to protect the public because they're going back out into the public. So we have to meet that person's needs, because often love, belonging, and self-esteem needs are not met when isolation precautions are used. And you can help meet those needs by just kindness and caring, sincerity. Persons with poor vision need to know who you are. So, of course, introducing yourself and telling them what you're there for and what you're going to be doing. And, they can't see you behind a mask or a goggle or a face shield. So make sure that sometimes you have to show them your face before you actually put that mask on, and then state your name and explain what you're going to do, and then put on your PPE. So sometimes you have to talk to them from the doorway. So the bloodborne pathogen standard is intended to protect the healthcare team from exposure to blood and other potentially infectious materials, or OPIM. It is a regulation of OSHA. So this would include HIV and HBV are both bloodborne pathogens, okay? HIV is the human immune immunodeficiency virus, and HBV is hepatitis B virus, okay? The center has to have an exposure control plan. So basically, these plans identify the staff at risk for exposure to blood. Fortunately for us in long-term care, who work in long-term care, our exposure risk is pretty low. But the plan, everybody has to have a plan, and the plan includes actions to take, what to do if there is an exposure incident, and then what to do if there's a spill, and then what to do. There's all kinds of things of what ifs. So these are the things that we have to know what to do in case this and this happens. And then staff at risk receive free training. This is nothing you have to pay for. And most of this training has to be done yearly. So if you have an exposure, this exposure, so you have to have an exposure control plan. So this would reduce the risk of exposure to hepatitis B, and we can do that by taking the hepatitis B vaccination. But now, before, when I was a kid, there was no such thing as hepatitis B vaccination. And when I was a young nurse, we did have hepatitis B vaccination, but it was taken on a voluntary basis. Now we know that since we have this vaccination, we now give it to children. So they get it when they're young, and then hopefully they will be have an immunity build up, and they'll never have to deal with this. That's the ideal. But engineering and work practice controls, wearing your PPE, and then looking for contaminated equipment, making sure that's cleaned and decontaminated as quickly and soon as possible. That includes work surfaces, so you have to use the proper disinfectant, and use a brush and dustpan or tongs to clean up any broken glass. That's why a lot of things are in plastic. Contaminated waste, special measures are required when discarding this. The containers are used for discarding regulated waste are closable, puncture resistant, leak proof, color coded in red, and have the biohazard symbol. And this would be like your sharps containers is now what I'm talking about here. We put needles in it, we put razors, your disposable razors go in a biohazard box. And basically, you would use this so that the needles don't come through and hurt somebody. The center has to be kept clean and sanitary, and special measures are required for contaminated laundry. They get put in special bags that are then, what happens here is they're put in special bags that they can actually thing into the laundry so the laundry person doesn't have to touch it even though they'll be wearing gloves, and that bag dissolves in the laundry in the laundry process, and then the clothes are washed and decontaminated. Exposure. Now, if you get an exposure can be in the eye, it can be the mouth, any mucous membrane, not any non-intact skin, or a parenteral, which contact with blood, and that's a needle stick. Okay. First off, you want to report the exposure incident once. Confidentiality is very important. You want to make sure to wash that area or rinse that area thoroughly as possible, and then you that taken care of. Then there'll be protocols to follow in that too. Surgical asepsis, remember that sterile technique, and that keeps equipment and supplies free of all microbes. And we usually just use this anytime the skin or sterile tissues are entered. If the break occurs in a sterile technique, infection is a risk. It would be considered contaminated. Most of the time, you don't have to worry with the surgical asepsis, but medical asepsis, you do. Of course, we are all responsible in preventing infection, and even one careless act can spread microbes. So that first time you go out that door and you think, "Oh, I'll get that with the next. I'll wash my hands with the next patient," you're really putting yourself at risk as well as everyone else before you get to the next patient. So this ends chapter, whatever chapter this was, chapter 13, I believe, for preventing infection, and I will talk to you soon.